Hi, my name's Guy and I'm a dentist. I'm here today to talk to you about Philips Zoom tooth whitening, which may have been offered to you by your dentist as an adjunctive treatment to your in-chair whitening or as a standalone treatment. To ensure you get the best possible results, it's very important you follow the instructions, and I'm here today to give you a step-by-step guide to show you how it's done. When you first open your kit, you'll find a few things inside. Firstly, you'll find your patient instructions and shade guide. It's very, very handy to read your patient instructions just so you're very clear on how things are done. Also, you'll find a shade guide, which your dentist may decide to mark your starting shade so we can monitor things as they're going along. Secondly, you'll find your bespoke tooth whitening trays. These are made after your dentist takes your first set of impressions and they only fit your teeth, so make sure you look after them. Finally, your tooth whitening syringes. They're very easy to assemble, which I'll now show you with a brief demonstration. The first thing you need to do is to assemble your syringe, which is very straightforward. Firstly, there's a small cap which you have to unscrew and remove. Then, simply take one of the small nozzles you'll find within your whitening tube pack, push and twist, and there we go. Then simply remove the small rubber tip and you're ready to go. It's then simply a case of picking up your bespoke tooth whitening tray and putting a small rice grain sized amount in each tooth until every tooth has a small amount in, and then you're good to go. Before you start, it's very important that you floss and brush your teeth so that the whitening gel reaches every available tooth surface. Moments before you seat your tray, you also have to dry your teeth thoroughly. Once your teeth are clean and dry, you seat the tray as simply as this. Once these are fully seated, you may notice some excess gel. This can simply be wiped away with some tissue or a cotton wool bud. Once they're in and you're happy, it is then quite literally a case of leaving them in place for the advised amount of time. Your dentist will have instructed you on the specific time frame based on whether you are using day white or night white. If you are using day white, we usually recommend 30 to 60 minutes. But if you are using night white, this is an overnight treatment and can be left in your mouth for up to 8 hours. When you're ready to take them out, just give them a quick wash and store them back in the box provided, ready for next time. You can then put everything back in the case and store safely in a drawer or cupboard. You should start to see a noticeable difference within a matter of days, but for some people it can take a little longer, which is perfectly fine. As well as this, some people may experience some sensitivity, and in the unlikely event that this happens to you, your dentist will be able to advise you appropriately. By following these simple instructions, you will ensure you get that perfect white smile in a safe and effective way.
Innovation in you. Philips.